The unseen murderer known as rabies inhabits everyday life. Uncover a terrifying reality by exploring the depths of the shadows. Everyone seems to be after each other in this world. As events unfold, additional details about our cunning adversary will become apparent. Observe as invisible creatures engage in combat, a timeless tale of perseverance. If you're afraid, you should not come on this journey with us. Perfect for those who thrive on adventure and find thrill in discovering new things. Tune in for continuous updates as we add fresh information every minute. Every piece of information we uncover brings us one step closer to vanquishing this invisible foe. Are you prepared for the next phase of the rabies war? The truth is finally emerging, and that's awesome. Rabies, a brief overview. The extremely harmful rabies virus typically infects people and cats. Viruses belonging to the genus Lyssavirus cause rabies. Bite or scratch wounds made by an infected animal's saliva are the most common routes of viral transmission. Inflammation and a cascade of terrible symptoms are the results of the virus's journey via the nervous system to the brain after infection. The threat to cats. Cats, both domestic and wild, are susceptible to rabies. In many regions, especially where stray and feral cat populations are high, cats are among the most common domestic animals to contract and transmit rabies. The disease is particularly dangerous in cats due to their hunting habits and territorial fights, which increase their susceptibility to wild animals and, consequently, the virus. Symptoms in cats can vary but often include behavioral changes such as aggression or lethargy, excessive salivation, difficulty swallowing, and paralysis. As the disease progresses, it inevitably leads to death. What makes rabies particularly sinister is that by the time symptoms are evident, it is almost always too late for treatment. Rabies in humans, a dire concern. Rabies in humans is a dire concern due to its high mortality rate once clinical symptoms appear. Animals transmit the disease to humans, with the majority of cases resulting from dog bites. However, any mammal can transmit the virus, including cats, bats, raccoons, and foes. Understanding the transmission, symptoms, and prevention of rabies in humans is crucial for public health and safety. Transmission to humans. The rabies virus typically enters the human body through bites or scratches from an infected animal, depositing the virus into our tissues. It is not just limited to bites. It can also enter through any open wounds or mucous membranes. Once inside, the virus doesn't immediately wreak havoc, but instead slowly replicates in the muscle cells, evading the immune system. It then methodically travels along the peripheral nerves toward the central nervous system. The journey to the brain can take weeks to months, during which the virus remains undetected. Once it reaches the brain, it causes encephalitis, leading to severe symptoms like hydrophobia and aggression. Infected organ transplants have rarely transmitted rabies, showcasing their ability to bypass typical transmission routes. Understanding this transmission is vital for effective post-exposure prophylaxis. Administered promptly after exposure, PEP can prevent the virus from reaching the brain, offering a critical window to prevent the disease from taking hold. Incubation period. The incubation period for rabies in humans can vary significantly, typically ranging from 1 to 3 months. However, it can be as short as a week or as long as several years in rare cases. Factors such as the location of the entry wound and the viral load can influence the length of the incubation period. During this time, the infected individual does not show symptoms and may remain unaware of their infection. Symptoms and progression. Once the rabies virus reaches the central nervous system and symptoms begin to appear, the disease is nearly always fatal. Early symptoms are often nonspecific and can include fever, headache, and general malaise, making it difficult to diagnose in its initial stages. As the virus progresses, it causes the development of neurological symptoms, which can be classified into 2 forms: furious rabies and paralytic rabies. Furious rabies. This form is characterized by hyperactivity, excitable behavior, hydrophobia, fear of water, and sometimes aerophobia, fear of drafts or of fresh air. Patients may exhibit aggressive behavior and suffer from hallucinations and insomnia. Paralytic rabies, also known as dumb rabies, this form progresses more slowly and is less dramatic than the furious form. It is characterized by muscle weakness and paralysis, starting at the site of the bite and gradually spreading throughout the body. This form leads to coma and eventually death due to respiratory failure. Diagnosis and treatment. Diagnosing rabies before the onset of symptoms is challenging and usually based on the history of exposure in potentially rabid animals. After clinical symptoms appear, healthcare professionals can use several tests to diagnose rabies, including saliva, serum, spinal fluid, and skin biopsies. There is no effective treatment for rabies once symptoms have appeared. The focus is on preventing the virus from entering the central nervous system. Post-exposure prophylaxis, which involves wound cleaning and a series of rabies vaccinations, is the immediate treatment for someone who has been exposed to rabies. PEP is highly effective in preventing the disease if administered promptly after exposure. Prevention, a key strategy. Preventing rabies in humans involves controlling rabies in domestic and wild animals, vaccinating pets, and reducing human exposure to potentially rabid animals. Public education campaigns are crucial in endemic areas, teaching people to avoid contact with unknown animals and to seek medical attention immediately after potential exposure. International collaboration and vaccination programs for animals have been successful in reducing the incidence of rabies in various regions, but continued effort and awareness are necessary to prevent this deadly disease. In conclusion, rabies in humans is a preventable yet fatal disease if left untreated. Awareness, education, and prompt medical intervention are critical components in the fight against rabies. By understanding the risks and taking proactive measures, we can protect ourselves and our communities from the hidden danger of rabies. The role of global cooperation. Rabies is not just a local issue, it's a global concern. International cooperation is essential in sharing resources, strategies, and information to combat the disease. Efforts like the Global Alliance for Rabies Control's 0 by 30 campaign, which aims to eliminate human deaths from dog-mediated rabies by 2030, highlight the importance of global commitment. Rabies, a silent predator, continues to haunt our communities, affecting both humans and animals with its deadly touch. Despite its pervasive threat, we are not defenseless. Through widespread vaccination, responsible pet ownership, and informed public action, we can turn the tide against this ancient enemy. Vaccination stands as our primary defense, significantly reducing the risk of transmission and safeguarding our vulnerable populations. Every pet owner and community member must champion this cause, ensuring proper vaccination and care for all animals. The fight against rabies is a collective endeavor, demanding a commitment from each of us. By joining forces, we can protect our communities and move closer to a world free from the fear of rabies. The path is challenging, but the goal of eradicating rabies is within our reach.